Hello and welcome to Rise Unwind. My name is Dan. You know, each and every week we try to talk to people from across the country about things you can do in your neighborhood. You didn't know that? Well, now you do. And on this week's show, we got this.
I learned that although I'm taking an antidepressant for chemical imbalances, the chemical imbalances is not the whole picture of why I'm struggling with depression.
Consumers today see that taste and convenience and some of the practical benefits are the things that make a food feel worth it.
You can have underlying eczema on your body, but chronic hand eczema means you have red, cracked, uncomfortable, itchy, and even painful hands.
All of that and more right here on that show we like to call Rise and Unwind. Black History Month is wrapped up this weekend, but there's a health issue that deserves attention long after February. By 2030, nearly 40% of Black and Latino families in the United States could be impacted by Alzheimer's, and yet many families still aren't having the conversation. There's an initiative that is working to change all that, and it's called AlzInColor. So joining us today to talk about it is dementia care expert Dr. Fayron Epps. Dr. Epps, good morning.
Good morning. Thank you for having me.
It's good to have you here. The numbers around Alzheimer's in minority communities are tough to ignore, and still, it's something many families don't really talk about. Why do you think that is?
Well, I think they don't know these numbers, right? And so you talked about 40% by 2030, but more specifically, Black Americans are twice more likely to be impacted by Alzheimer's disease or a form of dementia. Latino families are 1.5 times more likely. And so this is a public health crisis. And it's urgent that we start doing something and have these conversations. And so another thing is that a lot of information and education are not coming to the communities of color. Also, they don't have access to resources and supportive programming. So AlzInColor is here to really change that. We want to make sure that these families, these communities have the resources that they need so they can have these conversations around brain health, dementia, Alzheimer's disease.
As Black History Month has come to a close, why is it so important for communities to keep these conversations going year-round?
Yeah, it is important because dementia, Alzheimer's disease does not discriminate and doesn't focus on just 1 month out the year. These alarming statistics happen because this disease occurs every day of the year. So we need to continue to have these conversations year-round. And it's so important, especially for women, because in the Black community, they are often a CEO of the health for their family. And so they got to know these resources. They need to know this information so they can encourage conversations at the kitchen table, conversations in their community.
And for somebody out there that might feel fine, but what could they do to protect their brain health before symptoms even appear? And what are some early signs families shouldn't be brushing off?
Yeah, so let's start with the early signs that you shouldn't be brushing off. So many times you have changes in your brain that occur 20 years beforehand. But when you start seeing these signs, some things you may see, and we always think about forgetfulness. And it's not just forgetfulness. It's like when you're misplacing items and you cannot retrace your steps. Also, not being able to complete familiar basic tasks. And another one that you may see is drastic personality changes. And when you see those things, we encourage you to share with your families, but also bring it to your healthcare provider. If that's a physician or a nurse practitioner, bring these concerns to them. Like I said, many times these changes in your brain occur 20 years before you see the signs. So engaging in brain health activities is so important. U.S. Pointer study just had some results released showing that when you engage in a brain health recipe, you can reduce your risk of dementia, and that is getting more sleep, eating a healthy diet. What's good for your heart is good for your brain, right? Knowing your numbers, monitoring your blood pressure is so, so important. Social engagement, exercise, these are things that we may already be doing and we need to continue to do so we can reduce our risk of dementia.
You're also involved with the initiative called AlzInColor. What is it, and how is it helping close some of those gaps?
Yeah, I am a supporting partner with AlzInColor, and that is a campaign that's focused on brain health conversations in Black and Latino communities. So we are focused on empowering communities with authentic storytelling. We provide resources such as education, testimonies. We also invite families to share their testimony because that's the only way that we can heal as a community and change this narrative. And so we are here to really support families and give them the materials that they need.
And for families just beginning this journey, maybe they've noticed some changes in a loved one, what's one piece of advice you always share?
I would say, and I know it's easy for me to say, but I ask you not to be fearful. When you get this diagnosis, your next thing would be to share with family, share with others, but also equip yourself with education. And so you will know what you can start doing to put things in place, because it is about being proactive rather than reactive.
So where can people go, learn more, and find support?
Yes, you can learn more on our website, AlzInColor.com.
Dr. Epps, I want to thank you for joining me today.
Yes, thank you.
More than 21 million adults in the United States are living with depression. And for many, it's not just a rough week or a bad mood. Major depressive disorder can linger, even when somebody is in treatment. There are also new technology-supported tools being added to traditional care that is designed to work alongside medication and therapy. Joining us today is Dr. Saundra Jain, a licensed professional counselor with more than 30 years of clinical experience, and mental health advocate Kelly Euchima, who has shared her own journey with depression openly. Welcome to the show, you two. How are you?
Very well. Glad to be here.
Thank you for having us.
Dr. Jain, for people who may not fully understand it, how is major depressive disorder different from everyday stress or sadness?
Great question. Major depression is chronic and pervasive. Symptoms can last for weeks, and that is quite different than regular day stress. So I'll turn to Kelly, ask her as a person with lived experience to speak to that.
For me, it's like a dark cloud 24/7 hanging over my head. But knowing there was a name to it when I was 19, when I got diagnosed, that was comforting, because I always grew up thinking something's wrong with me. I'm broken. I must be the only one.
Many adults continue to experience symptoms even while they're in treatment. From your perspectives, why does that happen? And what gives you hope about where care is heading?
Yeah, that is a challenge, because regular standard of care in the world of major depression is medication and or psychotherapy. The good news, it is effective for some people. And the less than good news is some people only achieve partial remission. So what's very exciting in this space is the emergence of this technology of digital prescription therapeutics, because it gives us a chance to offer our patients another alternative, something to add in addition to medication and psychotherapy.
We're hearing more about technology-supported tools, including prescription digital therapeutics. How do these fit into treatment landscape, and how might they change the day-to-day experience for patients?
Yeah, it's very exciting. I'll start, then Kelly, I'll ask you to chime in because you've got some actual real life experience. But prescription digital therapeutics are different than wellness apps. And this is how they're different. Prescription digital therapeutics are based in evidence. They're studied in randomized clinical trials. And one I want to speak to you about this morning, Kelly and I here on behalf of Rejoin, we want to tell you about that prescription digital therapeutic, which is an FDA authorized PDT for the treatment of the symptoms of MDD. It's for people who are 22 years of age and over who are also taking an antidepressant. And so I'm going to turn to Kelly because, again, real life experience will really give you a feel for this tool.
Because I struggle with depression, everything feels daunting and intimidating. I'm like, oh, adding one more thing. That's where Rejoin has come into my life and felt less intimidating, because it shows in the form of like an app on your phone. And it was just a 6-week program. And I found it to be so enlightening, because there are many therapy lessons, which are great, check-ins, reminders, but the brain training exercises, this was a whole new world for me, because with Rejoin, I learned that although I'm taking an antidepressant for chemical imbalances, the chemical imbalances is not the whole picture of why I'm struggling with depression. In my brain, the thinking part and the feeling part do not want to communicate. There's a big struggle there, and that's what we're trying to do. It's kind of like physical therapy for your brain, because we are training that muscle.
Yeah, and this is the concept of neuroplasticity. What you said, Kelly, the brain can change, and that is a message of hope for our patients.
And Kelly, you've been very open about your own mental health journey. What excites you most about how the conversation is changing, whether it's new treatment options, less stigma, or simply helping people feel less alone?
I don't know about any of you out there, but I grew up in a house where we didn't talk about any of this. We're not talking about feelings. We're not talking about any deep things. And it's so comforting that these conversations are so normalized, because I do think it really inspires people like me to seek tools and treatment to hopefully live a better life. And I can say wholeheartedly, I am living a much happier, more fulfilling life than I ever thought possible.
And Dr. Jain, from a clinical standpoint, what stands out to you about the growing understanding of mental health and the emergence of these newer technology-supported options?
Yeah, I think it's what we've been saying this morning, that it is simply another tool that is available. What Kelly said about chemical imbalance, neuroplasticity, this message of hope that the brain can actually change, that Rejoin in particular is designed to help the communication channel between the thinking and the feeling part of the brain, and believed to then reduce these symptoms of major depression. And that's connected to what we believe better outcomes for our patients. And that's really why we're doing this.
And for someone watching right now who may be struggling with depression, what would you want them to hear?
Yeah, from my perspective, don't do this alone. Depression is real. Reach out. We heal through community, connection, and conversation.
That and this constant belief that we are broken and unchangeable. I want to validate that, but also tell you, you can change. And we got you. I'm with you. I feel it.
Well, that's some positive energy right there. All right, where can our viewers go if they want to learn more?
Sure. To meetrejoin.com, and Rejoin is spelled REJOYN. And Kelly and I have good news for your viewers. There is a discount code, REJOIN26.
Kelly, Dr. Jain, I want to thank you two for joining me today.
So glad to be with you.
March is National Frozen Food Month, and new research shows 83% of shoppers say frozen foods actually make meal planning easier. I'm one of them. Chef and culinary expert James Briscione joins us to talk about how flexible eating habits are reshaping the American table. Welcome to the show, James. How are you, my friend?
Hey, thanks so much. Excited to be here and chat with you guys today.
Okay, so how are changing schedules and tighter food budgets kind of influencing the way people plan meals throughout the day?
Yeah, well, I think, just in general, eating has become a lot less structured. And frozen food really supports that across the entire day and the week, from breakfast, snacks, lunch, dinner. Having staples like frozen fruits, vegetables, proteins, and ready-to-eat options really allow you to build meals and snacks as needed. It just makes meal planning easier.
A lot of people still think frozen foods as just a backup plan, but from your perspective, how does it deliver value beyond just the price?
Yeah, and I think, it does go beyond the price tag, and affordability, of course, is really important. But I think consumers today see that taste and convenience and some of the practical benefits are, the things that make a food feel worth it. When we talk about value, it's also about quality, ease of preparation, portion control, reducing waste. Right, these are all really important factors when it comes to daily meal planning, and that's where frozen food, I think, really delivers. It gives you a lot more control over how food fits into your schedule and your budget.
Hey, I got no shame snacking on some dino nuggets, my friend.
That's right.
When you walk the grocery aisle nowadays, what changes stand out to you that reflect how Americans are eating today?
Well, I think, the variety that everyone sees on the aisle is absolutely amazing. And I think consumers are really driving that. They want flexibility. They want exciting new dishes. They want to change up the weekly routine. Maybe branch out from just the dino nuggets and find something else tasty, that you can stock in your freezer. But I think that's a really big piece. You can explore new foods without committing to a long list of specialty ingredients you might only use one time. You can cut down on food waste, and you can have something reliable in your freezer that's going to make mealtime or snack time easy.
Are you seeing generational differences in how people use frozen foods, like maybe a difference between the Gen Z versus Gen X or some of the older ones out there?
Yeah, absolutely. I think, Gen Z and millennials, I think, they're finding all of these exciting new foods and trends and global cuisines on social media through TikTok and Instagram. And there's so much innovation happening all the time on the food aisle. They can find those same trends and those same exciting new flavors in the frozen food aisle. Where, some of the older generations, I think they're, going to be more interested in the reliability, the practicality, the value, and the taste and convenience that frozen foods can deliver that really make meal planning and sticking to a budget simple.
And for those out there that want to explore more ideas or maybe learn more about National Frozen Food Month, where should they go?
That's right. March is National Frozen Food Month. So if everyone goes to check out easyhomemeals.com, they can find recipes, tips, and get in on a chance to win $10,000 in prizes.
Chef Briscione, I want to thank you for joining me today.
Of course, thank you.
It feels like every bill is going up right now, and insurance is definitely on that list. Homeowners and drivers across Florida are seeing higher premiums and wondering what's actually behind it. From natural disasters to inflation to legal costs, there's a lot happening behind the scenes. So joining us now is David A. Sampson, President and CEO of American Property Casualty Insurance, to help break everything down. Welcome to the show, David. How are you, my friend?
I'm doing fine. Good to be with you.
Welcome back to the show, my friend. A lot of people just open renewal notices that are higher than expected. Why do these costs keep rising for so many Americans?
Well, the increased cost of living for hardworking Americans is an urgent and pressing challenge all over, whether it's from gas to groceries to electric and utility bills or healthcare or childcare or housing costs, and certainly insurance is not immune from that. But as you mentioned earlier in your intro, there are really three primary driving factors that are behind this. The first is inflation. We're coming off in 2022 a record 40-year high inflation rate. And while the rate of inflation has decreased since 2022, prices haven't lowered. They're still going up. They're just going up at a lower rate. And that's certainly true for insurance input costs. So you think about the major cost drivers for insurance, it's the cost to repair homes. Home construction repair has increased, the cost of that has increased 48% over the last 4 years. The other major cost driver is the cost to repair vehicles in accidents. That has increased 44% over the last 5 years. The second factor is increased natural disasters. We are coming on, climate change and extreme weather have led to explosive losses of natural disasters. $522 billion in insured losses over the past 5 years in the United States, the worst period ever, and the most number of individual billion-dollar disasters over the past 5 years, and it just keeps going up year after year. And then the final factor that is a major driver of insurance premiums, especially auto premiums, is lawsuit abuse, frivolous lawsuits. The average family of four pays $5,000 in what's called the tort tax. That's the cost of every good and service that a family buys that's impacted by legal system abuse and frivolous lawsuits and runaway verdicts.
And from the industry side, what are insurers trying to do to stabilize things and improve affordability?
First and foremost, we're trying to prevent losses on the front end. If we can reduce losses on the front end, that's in the best interest of the consumer, as well as will help keep insurance costs down. And how do we do that? By investing in mitigation and resilience programs. The Insurance Institute for Building and Home Safety, funded by the industry, has been researching building codes and building standards that can help buildings withstand storms. That has been proven in the fortified home building code that so many homes in Florida have been built to. And you see the dramatic example of homes right next to each other. One home built to an old standard, another home built to the new standard, and the new standard home has virtually no damage and has withstood the hurricanes. So it's mitigation and resilience on the front end. And then secondly, we're looking to actively promote reforms that can reduce legal system abuse. And Florida has really been on the leading edge of systemic, meaningful legal reforms and passed by the legislature in 2022 and 2023. That's already having a dramatic impact in reducing the number of lawsuits and the cost of those lawsuits. So, for example, in 2025, the top 5 auto insurers in Florida reduced their insurance premiums by 6.5%, directly as a result of those reduced legal costs. And so it's having a real impact. This is not theoretical. We know how to reduce many of these loss costs that are driving up premiums.
So are there reforms or policy changes that could realistically help improve coverage options and bring some of those rates down?
Yeah, and I think that's happening in Florida because of some very good systemic reforms that have been passed over recent years. And, the Florida Department of Insurance has produced a lot of good studies on how to protect yourself from fraud, from unscrupulous roofing companies or independent adjusters that are out there that come into neighborhoods after a natural catastrophe. So lots of good consumer protection information from the Florida Department of Insurance. And the data on the reduction of legal cost in Florida that's been documented by the Florida Department of Insurance and by other independent analysis and white papers that have been done show that Florida has really been on the right track. And so I think the most important thing that Floridians can do is to protect the reforms that have already been passed over the last couple of years.
So before we head into another storm season, what should we be doing now to evaluate our risk and make sure that we are prepared?
Yeah, again, I would say have a insurance checkup with your local independent insurance agent. But look at making minor repairs on your house if you've got loose shingles or roofing that needs to be replaced. Do those small repairs now. Small repairs now can reduce the need for large repairs later on when a hurricane hits. Make sure that you've got a place to store all of your loose furniture around your house before the storms hit. Because so much of the damage is caused by flying objects in a hurricane. And so if you can secure the outside of your home, you can reduce broken windows and then the rain that damages the house as a part of the hurricane.
David Sampson, I want to thank you for joining me today. Where can we go for more information?
People can go to apci.org/insurance, and all of these tips are on that website and opportunities to dig deeper if they want to.
Thanks for joining us today, David.
My pleasure.
Dry hands happen, but what if it's not just dry skin? New research suggests about 1 in 10 adults in the United States could be living with chronic hand eczema, or CHE, and not even realize it. So joining us this morning are Dr. Omar Noor, a board-certified dermatologist, and Jennifer Etienne, a patient advocate living with CHE. Welcome to the show, you two. How are you?
Doing well. Thanks for having us. Yeah.
Okay, so what is some of the signs of someone eczema may not actually be eczema or be something deeper, such as like chronic hand eczema?
So it's important to understand chronic hand eczema, like you said, is its own distinct diagnosis. It's its own distinct condition. You can have underlying eczema on your body, but chronic hand eczema means you have red, cracked, uncomfortable, itchy, and even painful hands. And that's really what distinguishes it from eczema on the rest of the body.
So what are some of the triggers that can make the symptoms worse?
So that's really what makes chronic hand eczema so difficult and so confusing. Triggers can be different in every patient, and there are a lot of them. The most common ones tend to be a change of environment. I know you guys are down in Tampa with your nice warm weather, but here in New York, this cold weather can be very irritating for a lot of patients, can cause that kind of dry, cracked hands. We see it more often in certain occupations, healthcare workers, hairdressers even, people that work a lot with their hands. It could be a mechanic, someone that washes their hands or gets their hands wet very frequently, have higher rates of chronic hand eczema.
And Jennifer, can you share some of your experiences living with chronic hand eczema?
For me, some of the experiences have been feeling very isolated, alone, extremely insecure about how my hands look, because when we first meet somebody, you go to shake their hand and they're meeting my skin as this broken, itchy, inflamed, thick, scaly skin. And that can be very embarrassing. I used to feel very shameful around my skin condition, and living with it, sometimes it distracts me from my work, because if I get itchy, then I'm not able to focus on a task. Or if I'm washing dishes and the dish soap is something that's one of my triggers, I have to be careful of that. So just being super cautious and also having this paranoia of like not wanting to touch certain things. And for a long time, I felt very touch deprived because I was scared of others touching me and me touching others because I don't know how they're going to react to that, or if my skin is going to react to whatever they might be wearing, like a perfume or something.
So how did your symptoms affect your daily life, like whether that's work, relationships, or some of those everyday routines?
For me, some of my everyday routines would just be my chronic hand eczema was taking a lot of like that mental space. So for me, like completing tasks felt like a drag. It was just not fun to go through the cycle and not be able to like finish something. If I wanted to write something, like if I like to write as well. So for me, it was just kind of this prolonging of trying to maintain focus just so I can get a task done. So for me, it would take me longer to like do anything. And then with relationships, I would find myself not very affectionate, like even with my own niece and stuff like that, afraid of touching her or her touching me because she loves to wear scented lotions and stuff. So just being like touch deprived for a very long time and meeting new people and then having to explain my condition to them and not being sure how they're going to receive me. So for a long time, it kind of deal with that annoyance and being cautious of like, how is this going to affect this relationship that relationships with family members, because sometimes they may have seen you in a worse state than you already were, and kind of dealing with that annoyance and stuff. So for me, that's kind of how it affected my like daily life.
And Dr. Noor, why do you think CHE is so often overlooked by patients and even healthcare providers?
There's a multitude of reasons. The first reason that's very important for providers and dermatologists to recognize is that CHE presents very differently in different patients. It can be thick, it can be just little fissures or cracks within the fingers, it can be redness and scaling throughout the hands. Everyone tends to be a little bit different, so making sure that we identify the vast different clinical pictures of CHE. And then from a patient perspective, I understand patients come in, they say, I've had this dry hands for like so many years. Can you do anything about it? And patients don't realize that it's more than just dry hands. This is inflammation under the skin. And when identifying it appropriately, we can then schedule a path to treat it appropriately.
And Jennifer, from your experience, what would you say to somebody that might be dealing with similar symptoms right now?
I would say first and foremost, you are not alone. There's so many people who experience this, but they, it either gets dismissed or they dismiss it themselves. So you're not alone in this. But if the symptoms are persistent to the point where you can't complete work or it's affecting your relationships, it's so important to go see a dermatologist. That way you can, number one, get properly diagnosed. And then also you guys can start a treatment plan for you. So that way you can get the relief that you need.
And doctor, where can people go if they want to learn more or maybe get some help for themselves?
Absolutely. So the most important thing is knowledge, and there's a lot of great information online. You can go to www.learnaboutche.com, and that's CHE for chronic hand eczema.
Jennifer, Dr. Noor, I want to thank both of you for being here today.
Thank you.
Dan.
And that is it for Rise Unwind. I want to thank you for tuning in and checking out the show. I know it's so sad we got to leave so early, but if you like us so much, you want to follow us on social media, you can find us on Instagram, Facebook, our website, that's RiseUnwindTV.com, or subscribe to our YouTube channel, also at Rise Unwind. And until next week, that was the show we like to call Rise and Unwind.